Hello, my name's Louise. I'm one of the SecuriCare community Stoma Care Nurses, and I'm here today with Caroline, who's going to share her story with us. Would you like to introduce yourself, Caroline?
Hi, my name's Caroline Gould. I've been a stoma patient for 9 years. I was introduced to Louise a few months ago, which was a life-changing event for me.
So you mentioned, Caroline, that we met a few months ago.
Yeah.
And obviously that was at the first time that we had our meeting to do a review together. Could you tell us a little bit about that first review and how you came to having that review with me?
Yeah, sure. I basically met Louise through SecuriCare, who offered me the service of Louise as a stoma nurse. And that has absolutely changed my life. It really has.
So I remember when we first met, you were very anxious, you were very sort of, wasn't really quite sure what to expect or whether we would achieve anything, I suppose. Mm. You weren't sleeping, you had constant skin infections, you've had lots of other things going on medically as well.
Yeah.
So for me, there was a lot to sort of achieve and gain from doing this review with you because, you know, I really wanted to help you improve your quality of life. So what were your sort of first impressions when I came? What were you expecting of having the review?
When I met Louise, actually I was anxious because anything to do with medicine or anything like that, I suddenly sort of get a bit worried. But I have to say she did put me at my ease, and I was very honest with her and said, you know, you need to write things down because I do forget things. And she took me back to basics. She had a look at the problem and asked me so many questions. And, you know, and that gave me the sort of arena, if you like, to just spill the whole lot out, how difficult it's been. You know, and I've had really over 3 years of my life been dominated by infection, really nasty infections where I've needed IV antibiotics, wet beds. Sometimes the bed would be wet 3 or 4 times a night. I've got a series of duvets and things, and totally miserable, absolutely miserable. So that's where we kind of started. And then, of course, Louise asked if she could see said stoma. And she took it from there.
Yes, I remember looking at it for the first time because obviously you'd evaluated the pouch on your colostomy and you'd really liked it, didn't you? Yeah. So we kind of had that in the back of our minds that we might use that again, but obviously we needed to have a good look at the stoma and see whether it would be appropriate. So I remember looking at it and thinking, wow, like, that's such a big area of sore skin, and it was wet and weeping, and you said that it had been like that for years. Yeah. I remember it sort of coming all up around here, and you've just been putting up with it. And like you say, getting up multiple times a night, yeah, washing, bedding and not sleeping and having to sleep upright. And like the list just went on, didn't it?
It did, yeah.
So we, like you say, we took everything back to basics, didn't we? And we thought we need to sort the skin out first. We thought we'd change the appliance to see whether that might be a bit more suitable, which we did, and thankfully it just worked, didn't it? And from there on, we kept reviewing it and checking it and trying different things with the skin, and just seems to have done the trick now.
It does. And also, I need to also add, apart from the skin being really bad, my umbilicus was literally pouring pus. You know, so this was quite a serious infection, which nobody could get a handle on, sort of surgery-wise. I was always on antibiotics, always on oral steroids. It was just completely miserable. And I think going back to the basics, this is the first time anybody has actually said, right, take that off and let's see what's happening. And that's where we started from. And Louise also wrote out a low list of things of what would improve it, things that might help. And I've still got that today because it still helps me, you know, if I forget things. Yeah, so it was an amazing start. And within very short space of time, actually, the improvement was absolutely amazing. Because I've obviously started using the well-end products. It could have all gone wrong. It hasn't. And as you mentioned, my son's wedding was coming up, which, you know, meant it was an overnight stay. Also, lots of people looking at me. The chances were in the cathedral I could have wet myself. You know, the whole thing to me was frightening, and I really thought of not going because I thought I'd spoil it. But I did go, and I had an amazing time, and I had no issues whatsoever. And I have to say, I've had no antibiotics, I've had no steroids, and the difference is amazing, isn't it?
Yeah, I think...
I don't remember ever seen it like that.
No, and I think from my point of view, just coming to see you looking happier and you look healthier and you're getting some sleep and just everything, like it's just a holistic approach to taking the review, isn't it?
It is a holistic approach, and that's not something I've had, because you have a confined 5 minutes in the hospital, you know, and if you're peeing the bed several times, you can't get all that in. And then actually in a hospital arena, I don't want to tell them that either. But, you know, you did make me feel comfortable, and I thought, let it just all come out. Excuse the pun. And it was, I can't tell you. I've gone from getting up in night, putting the washing machine on, upsetting my dog, and now I don't have to have the extra stuff on the bed, 4 pairs of pyjamas, 2 duvets. I'm almost normal. Well, I wouldn't go that far, but it's really, really changed my life. And I go out a lot more. And as Louise said, I feel I'm a different person because I've got a bit of confidence back, which I completely and utterly lost.
As a Stoma Care nurse, I have come across a lot of patients in my time who have not reached out for a stoma review because they feel that the support is not out there, or they're not aware of the support that's available to them. I would always urge anybody to reach out to their local stoma nurse, or SecuriCare have got Stoma Care nurses in the community who may be able to come and support you with any problems that you might be having. These can be things such as leakages, sore skin, and so on. You don't need to put up with them, and I would always recommend that anybody keep up with a regular stoma review. I don't know if you've got anything to add to that, Caroline.
Yeah, I have. I didn't realise that somebody like you would be available to me, so it wouldn't have even crossed my mind to actually speak to SecuriCare to say, is it available? Because I wrongly saw it as a company that delivers my needs sort of in a physical manner, but not help otherwise. And I would implore people out there, actually, the difference it's made to me, to contact your company, contact SecuriCare. The help is absolutely out there. It's absolutely changed my life. I've gone from somebody who's almost housebound to actually becoming more of a social butterfly. So, you know, please take the care that's there. It's ongoing. You get everything you need, and you can contact them at any time. Doesn't matter how big or small you think the problem is. And I just want to say thank you.
SecuriCare have got one of the largest team of independent specialist Stoma Care nurses in the UK. We can arrange a review with you over the telephone, online, in person in clinic, or in your home. If you would like to find out more about the SecuriCare nursing service or the home delivery service, please visit our website for more information or click on the link in the description below.